there any scientific reason to believe that?
The basis for any surmising that that might happen is based on what we see every year with influenza, which actually, as you get to March and April and May, it actually goes way down, and other non-novel coronavirus, but common cold coronaviruses often do that. So for someone to at least consider that that might happen is reasonable, but, underline but, we do not know what this virus is going to do. We would hope that as we get to warmer weather, it would go down. But we can't proceed under that assumption. We've got to assume that it's going to get worse and worse and worse.
Okay. The president predicted that there could be a vaccine in a few months. I think you contradicted that today, and I think you contradicted that at that time. I just want you to be very clear. Is there any chance we will have a vaccine in a few months?
No, I made myself clear in my statement.
Okay. Dr. Redfield, the first case of community spread of coronavirus took place on February 26. That is infection of someone who did not have a clear travel history to China or direct contact with someone who did. Why wasn't the decision made on February 26 to expand your testing criteria for anyone displaying corona-like symptoms at that point instead of waiting until March 4th to broaden the criteria?
Well, that's a good question, Congressman. I mean, we always left the discretion to do testing to the local public health group. If you look, we always had that discretion. We never refused testing from anybody, but we did give guidance, as you point out, originally to do testing for individuals that presented with certain clinical scenarios secondary to travel to China. Those two cases in California and several others obviously led us to reconsider those and make it very clear that we wanted up front to tell clinicians if they suspected and the health department suspected, they should send that sample to the health department or us to CDC.
Okay, we've been hearing stories about people who have had very compelling reasons to get tested but were not able to. I'll give you one example. A nurse in California was quarantined after treating a patient who had coronavirus and then showed symptoms of the disease herself. On March 5th, the day after you brought in the testing criteria, she put out a statement about her situation, and she said, I quote, "The public county officer called me and verified my symptoms and agreed with testing, but the national CDC would not initiate testing. They said they would not test me because if I were wearing the recommended protective equipment, then I wouldn't have had the coronavirus." Are you familiar with this case?
No, and I would think that this is a misunderstanding if it did occur.
Okay, so what is the standing criteria, the existing criteria for testing now, so we have no confusion about it?
Again, it's if a clinical physician, a physician, nurse practitioner, or healthcare provider feels a test is indicated, then we
based on what?
Based on their clinical assessment.
And that's based on does it require that the person have to have had contact with someone who had been on a cruise or who had been to China?
This is their clinical assessment. We're not going to judge the clinical assessment. We also say if it's the clinical assessment or if it's the assessment of the public health department, that those individuals. And again, these are decisions. What happens is in the time when testing was limited to health departments, the local health department makes that decision, and then but they have followed CDC guidance. Now, we've made it very clear, it's up to the individual health provider and the individual public health to make that decision.
Okay, could you make a public service announcement right now for people who are asking the question of whether or not they should be tested? I hear from constituents who are having flu-like symptoms. They want to know, what should they do? What should they do?
Well, as Dr. Fauci said, the first thing I would do is to tell them to contact their healthcare provider or their emergency room and tell them they're concerned they may have coronavirus infection, and then follow their instructions to where to get the test. All right, and then proceed with getting the appropriate clinical evaluation.
Okay, so they should call someone before they go anywhere.
Well, we'd like to do that because if you really think you're infected, we're trying to avoid someone to walk into a 200-person, 100-person emergency room first. It's just to call in advance, and then they'll arrange exactly how they're going to get the test, how they're going to see the patient. They're going to be prepared when that patient comes to the emergency room that they're going to be able to isolate them, get them tested, get them properly evaluated.
Okay. Thank you for your work on behalf of the American people. I yield back, Madam Chair.
Thank you. The gentleman from Texas, Mr. Cloud, is recognized for 5 minutes.
Thank you, Chairwoman. Thank you all for being here today. Appreciate your work on this. Dr. Redfield, I appreciated you talking about the ever-changing dynamics of the situation, especially in the sense that scientists even every day are learning more and more and how to deal with this and how to address it. It's been difficult, of course, to get